Hello, Michael Corsillas here today. I want to talk to you about pain. Something we don't like, but we have it for a reason, right? If we didn't have pain receptors, we'd probably be walking on that foot forever. Like, oh, I didn't notice there's a nail in my foot, right? So we have pain for a reason. It also tells us when not to push ourselves too hard, right? So you got to listen to that pain. However, there are some folks who have chronic pain. They're like, man, I'm still having pain even though I've been resting my arm, or still having these headaches or what have you. So we do deal a lot with chronic pain at our clinic here, and I want to just go over a few things about chronic pain, or just pain in general. So there's a few things that I usually talk to patients about. So a good example is like someone comes in, they got this neck pain, shoulder pain, and what to do about it. So there's a few things we usually do. This is more generalized in healthcare. If someone comes to us with pain, like if you were to go to urgent care for you got neck pain, or go to your primary care provider for neck pain, we'll do an evaluation, we'll get some history done about you, and then we'll make a couple recommendations. For pain, a lot of times it's just short-lived. We'll try to find out what caused it, and then of course come up with some treatment suggestions. So if it's like, oh yeah, I got in a car accident, and if there's no big red flags where like, you know what, I don't think you really need x-rays or imaging at this point, you probably need conservative treatment. So more often than not, we'll recommend conservative treatment once we found the underlying issue. And that's another kind of thing I want to talk about too, is the underlying issue. But a lot of times conservative treatment will consist of anything from like massage, chiropractic treatment, physical therapy, acupuncture. I don't know if you ever heard of Reiki or Bowen work, which is kind of like acupressure, or energy medicine when it comes to Reiki. But all those conservative treatments have been shown to really be effective. So more often than not, we'll recommend, let's try some conservative treatment like physical therapy for 4 to 6 weeks, for example, and then reevaluate and see how things do. See how you do. But a lot of times what we do also at our practices, we really want to focus on if there's any other underlying issues, especially if this pain has been going on for a while. So say you've done all the conservative treatments, physical therapy, acupuncture, etc. Like, man, I'm still in pain. Then at that point we might consider a few other things. Some folks will add an anti-inflammatory. Our goal in life, I've talked about in other blogs, is really want to lower chronic inflammation. If you just had a car accident, you're going to get some inflammation going on. But you know, after you ice it and eventually add some heat or contrast hot and cold, the inflammation will go down. Sometimes when you're getting this chronic inflammation, it keeps coming back. Then some folks will add medication, like anything like ibuprofen, or Tylenol, or turmeric supplements, or digestive enzymes to help with inflammation, or even CBD cream to help with inflammation. CBD is totally fine in my book because it does help with inflammation. When it comes to other medications, yeah, ibuprofen, anti-inflammatory, Tylenol works a little bit for inflammation. Sometimes we'll add a muscle relaxer prescription. There's a time and place for pain medication. When I say pain medications, those are more the opiate-based ones, or opiates, or opioids. And I'm sure you heard of the opiate epidemic, right? Those are medications really, there's a time and place. If you have a fracture or or had surgery, crazy amount of pain, yeah, time and place for some medications, but they're really not meant for long-term, short-term use. It's when it's long-term use, if you're just relying on that to kill the pain, that's where you can get addicted to it. And that's where I have a problem with that. And so, time and place for those kind of medications. They're just masking pain, not doing anything to heal it. They're not lowering inflammation, nothing like that. So sometimes when you have this chronic pain, we might do further testing at that point. When you've failed the conservative treatments, we might try anything out, like looking at your diet. Do you eat junk food all the time? Are you eating all this crap? Are you having a lot of sugar? Do you turn to sugar under stress, even physical stress like pain? Because sugar, simple carbs, refined carbs, all those toxins really are toxic to the body, and they cause inflammation. So again, a goal in life for lower inflammation. So you cut out sugars. You got to eat healthy. So you got to have plenty of protein, nutrients, minerals to help heal up those muscles as well. So clean, healthy eating. Always try to eat organic when you can, and really avoid those sugars, refined carbs. And then if you have food sensitivities, like you react to dairy or gluten, cut those out too, because that's causing inflammation. So if you try the conservative treatments, natural supplements, natural anti-inflammatories, natural muscle relaxers, even like magnesium, making sure you're eating healthy, drink a lot of water. You also have to focus on stress too. So if you're all stressed out, tensed out, that's going to cause, in my opinion, some inflammation going on in the body and really delay healing. One of the other treatments, conservative treatments I recommend is hyperbaric oxygen. I don't know if you ever heard of hyperbaric oxygen therapy or HBOT, H-B-O-T, but that's a way to increase atmospheric pressure by like 1.2, 1.3 atmospheres. When you have that increased pressure, when you're sitting in this chamber, this device, like we have a hyperbaric oxygen therapy device in our clinic, we have a lot of our chronic pain patients do, it will increase atmospheric pressure, which drives oxygen deeper into the tissues, not just in the lungs and the tissue, but deeper into the tissue to actually be more effective to heal. So hyperbaric has been shown to help really lower inflammation, especially chronic inflammation, so which will help with chronic pain. So HBOT is another effective treatment. So those are just a few of the things. There's a lot of different things when it comes to chronic pain to talk about. Even people who have problems with anxiety and depression, you know, certain antidepressants actually work for chronic pain. A lot of chronic pain patients talk to a pain counselor. They actually need to talk to someone for pain therapy. We have to change our mindset, but also we have to address the mood component too. So it's definitely a holistic type of picture that you look at when it comes to treating pain. And then even there's addressing the adrenal glands, the stress glands, which make cortisol, which is like, think of that as like the body's way to deal with stress and inflammation. So the adrenals are definitely taxed with chronic pain. So it's another thing we got to address. So definitely a lot of different things to address when it comes to chronic pain. But hopefully a few of these tips help out. Start conservative. You can do integrated treatments like natural supplements, medications, testing, further testing, imaging, etc., kind of moving down the line. But if you need extra help, definitely shoot me a comment, leave us a message, and let me know if there's anything else I can do to answer your questions and to help out. So hopefully this helps, and I'll talk to you guys later.